Hello, and welcome to For the Love of Family. My name is Katie. I'm currently doing my undergraduate studying at Northern Kentucky University, studying neuroscience and psychology, and this video is to help inform people of bulimia, give some causes, effects, things along those sort, and just help spread information. A quick disclaimer, I am not a licensed clinician. If there are any concerns, I encourage you to seek professional help. There will be links in the description. The DSM stands for the Diagnostic Statistical Manual, and the DSM is what most clinicians in the United States use to diagnose most psychological disorders. And so the DSM criteria for bulimia is as follows: reoccurring episodes of binge eating. An episode of binge eating is characterized by both of the following: either eating in a discrete period of time within a 2-hour period, an amount of food that is definitely larger than most people would eat during a similar period of time and under similar circumstances, a lack of control over eating during that episode, feeling that one cannot stop eating or control how much they are eating. Bulimia is also characterized as the binge eating and inappropriate compensation behaviors. Both occur on average at least once a week for 3 months. Reoccurring inappropriate compensatory behavior in order to prevent weight gain, such as self-induced vomiting, misuse of laxative, diuretics, or other medications, fasting, or excessive exercise. Self-evaluation and unduly influenced by body shape and weight. The disturbance does not occur exclusively during episodes of anorexia nervosa. This can be a little bit confusing because there is a subtype of anorexia nervosa that does involve binging and purging, which can be confusing, but the main difference is that to be diagnosed with bulimia, you typically do not restrict, whereas in somebody suffering from anorexia nervosa would restrict constantly and have constant restricting, such as that. It is possible to exhibit some of these signs but not be diagnosed with bulimia due to the time restraint that they've placed on it, so at least once a week for 3 months. If you haven't been suffering for 3 months or you don't do it as often once a week, there are other disorders that you can be diagnosed as that are not as severe as bulimia, but it is still something that should require treatment if there is any concern. So the causes of eating disorders are a little bit confusing because it's typically not one thing. There have been strides in science that show that there is a genetic component to it. If the mother suffers from an eating disorder, their child is more likely to suffer from it. But there are also cultural influences, the situation that the individual is in. This could be if there's a traumatic event that has occurred or a big change like starting high school or moving into college can oftentimes trigger for some people, as it can be used as a coping mechanism. But one big thing that differs from bulimia is that it can stem from weight loss dieting. This is due to the fact that severe restriction of calories like starvation would cause a binging episode, and then the guilt from that causes the purging. This is a lot of ways that people start for the first time doing this, is they get extremely hungry, which causes a reaction in the body to want to eat, then they lose control and the purging follows. Comorbidity is when somebody with one psychological disorder also suffers from a different or other psychological disorders. So in eating disorders, anxiety and depression are very common things to suffer from. However, those with eating disorders can also suffer from things like OCD, body dysmorphia, which is when your sense of yourself, your view of yourself, does not match the reality of your body. Low self-esteem, perfectionism, and substance abuse. In bulimia, substance abuse is a pretty big one, especially when it comes to laxatives and things like that. However, there are a multitude of other disorders that those can suffer from, and it's also possible that if somebody has an eating disorder, that they don't suffer from any other psychological disorders. This is a list of some warning signs that have been seen in those suffering from bulimia. I do want to point out, though, that you can be diagnosed with bulimia and not have any of these warning signs, just as you can have a couple of these warning signs but not be diagnosed with bulimia. So difficulties with activities involving food, loneliness due to self-imposed isolation and a reluctance to develop personal relationships, deceptive behaviors relating to food. So this would be like hiding food, taking it to a private place where they can binge, fear of the disapproval of others if the illness becomes known. I think this is a big one for bulimia because it's typically seen as more gross because you have the self-induced purging, the excessive exercise, things like that, mood swings, change in personality, emotional outbursts or depression, self-harm, substance abuse or suicide attempts. So this is going back to the comorbidity that can be involved in bulimia, sensitivity to references about weight or appearance, guilt, self-disgust, self-loathing, anxiety, depression, frequent trips to the bathroom, especially after eating, food avoidance, dieting behavior. This may be due to the fear of gaining weight, and it may also be to avoid the unpleasant ritual of purging afterwards, fluctuations in weight, erratic behavior, and mood swings. So the effects of bulimia on the body, I think this diagram is great. Obviously, it can affect a lot of different parts of the body. I think the most commonly known ones are the mouth, throat, esophagus. So constant vomiting can erode the teeth. You can have gum disease and tooth decay, just as it can also erode the throat and esophagus, and you can have a sore throat, indigestion, heartburn, inflame or rupture of the esophagus. But it can also cause an irregular, slow heartbeat, cardiac arrest, heart failure, some of the same symptoms that you would see in somebody suffering from anorexia. Same way it affects the brain. You can have that preoccupation with food and weight, the low self-esteem, anxiety, depression. It can also cause calluses on the knuckles from induced vomiting, dehydration. In extreme cases, it can cause an irregulation or absence of periods, and if that goes on long enough, infertility. If you're interested in more of the effects, I will make sure to provide links in the description of a full list and some personal stories that show the effects that they've had. I want to be very clear that recovery is possible. A lot of people suffering from bulimia do recover. There are a couple different options. For those severely suffering, inpatient treatment is an option. However, the majority of people do get treated with outpatient. I will link in the description a checklist that is used to determine if you should do inpatient or outpatient, but typically outpatient treatment is more available to more people. FBT stands for family-based therapy. This is a therapy approach that works on the entire family structure and everyone in the family, not just the individual suffering with an eating disorder. This can be extremely helpful because it not only helps improve the individual, but it improves their environment as well. And so along those lines, it helps them recover for longer. This works in ways, things like having family meals together, doing snack prep together, talk therapy, things along those lines. CBT stands for cognitive-based therapy, and this is an approach that looks at your cognition, so your thoughts and your behaviors, what you're doing, the link between them, and using both to improve the individual's health as a whole. So the thought of, I ate too much, I'm going to gain weight, and the behavior of throwing up to combat that, working on the guilt of the thought, and also preventing the behavior. Everyone is different. If there is any suspicions or doubts, please seek help from a professional who can give a proper diagnosis and give the correct help for your situation. I want to emphasize that my videos are not a replacement for treatment. They are not a replacement from getting an actual diagnosis. So if there is any disturbing or concerning behavior, please seek help from a professional. Thank you for watching my video. If you have any further questions, feel free to leave a comment. If you want to share your personal stories or build a community in the comments, I would love to read them. And thank you for coming to my channel.